Cefuroxime is a cephalosporin indicated for the treatment of a variety of infections including acute bacterial otitis media, several upper respiratory tract infections, skin infections, urinary tract infections, gonorrhea, early Lyme disease, and impetigo. In this video, let's find found. What is cefuroxime? What is cefuroxime used for? Contraindication. What are the side effects of taking cefuroxime? How does cefuroxime work? How to use cefuroxime? What is cefuroxime? Cefuroxime, sold under the brand name Zinacef among others, is a second-generation cephalosporin antibiotic used to treat and prevent a number of bacterial infections. These include pneumonia, meningitis, otitis media, sepsis, urinary tract infections, and Lyme disease. Cefuroxime was patented in 1971 and approved for medical use in 1977. It is on the World Health Organization's list of essential medicines. In 2020, it was the 325th most commonly prescribed medication in the United States, with more than 800,000 prescriptions. What is cefuroxime used for? For the treatment of many different types of bacterial infections such as bronchitis, sinusitis, tonsillitis, ear infections, skin infections, gonorrhea, and urinary tract infections. Contraindication. Cefuroxime injection, for injection USP and dextrose injection USP is contraindicated in patients with known allergy to the cephalosporin group of antibiotics. Solutions containing dextrose may be contraindicated in patient hypersensitivity to corn products. Side effects. Cefuroxime is generally well tolerated, and its side effects are usually transient. If ingested after food, this antibiotic is both better absorbed and less likely to cause its most common side effects of diarrhea, nausea, vomiting, headaches/migraines, dizziness, and abdominal pain compared to most antibiotics in its class. Although a widely stated cross-allergic risk of about 10% exists between cephalosporins and penicillin, recent assessments have shown no increased risk for a cross-allergic reaction for cefuroxime and several other second-generation or later cephalosporins. Pharmacodynamic. Cefuroxime is a beta-lactam-type antibiotic. More specifically, it is a second-generation cephalosporin. Cephalosporins work the same way as penicillins. They interfere with the peptidoglycan synthesis of the bacterial wall by inhibiting the final transpeptidation for the crosslinks. This effect is bactericidal. Cefuroxime is effective against the following organisms: aerobic gram-positive microorganisms, Staphylococcus aureus, Streptococcus pneumoniae, Streptococcus pyogenes. Aerobic gram-negative microorganisms, Escherichia coli, Haemophilus influenza, including beta-lactamase-producing strains. Haemophilus parainfluenzae, Klebsiella pneumoniae, Moraxella catarrhalis, including beta-lactamase-producing strains, Neisseria gonorrhoeae, including beta-lactamase-producing strains. Spirochetes, Borrelia burgdorferi. Cefuroxime acts till is the prodrug. Mechanism of action. Cefuroxime, like the penicillins, is a beta-lactam antibiotic. By binding to specific penicillin-binding proteins, PBPs, located inside the bacterial cell wall, it inhibits the third and last stage of bacterial cell wall synthesis. Cell lysis is mediated by bacterial cell wall autolytic enzymes such as autolysins. It is possible that cefuroxime interferes with an autolysin inhibitor. Half-life. Approximately 80 minutes following intramuscular or intravenous injection. Dose. The dose of this medicine will be different for different patients. Pharyngitis/tonsillitis. 250 mg PO/Q12HR for 10 days. Acute bacterial maxillary sinusitis. 250 mg PO/Q12HR for 10 days. Acute bacterial exacerbations of chronic bronchitis. 250 to 500 mg PO/Q12HR for 10 days. 500 to 750 mg 4Q8HR, switch to oral therapy as soon as clinically possible. Secondary bacterial infections of acute bronchitis. 250 to 500 mg POQ12HR for 5 to 10 days. Uncomplicated pneumonia. 750 mg 4/IMQ8HR. Uncomplicated skin structure infections. 250 to 500 mg POQ12HR for 10 days. 750 mg 4/IMQ8HR, switch to oral therapy as soon as clinically possible. Uncomplicated urinary tract infections. 125 to 250 mg POQ12HR for 7 to 10 days. 750 mg 4/IMQ8HR, switch to oral therapy as soon as clinically possible. Gonorrhea. Uncomplicated, 1 GPO or 1.5 g/IM once at 2 different sites with 1 g probenecid PO. Disseminated, 750 mg 4/IMQ8HR. Early Lyme disease. 500 mg POQ12HR for 20 days. Severe or complicated infections. 1.5 g 4/IMQ8HR may be administered Q6HR in life-threatening situations. Safety advice. Advice and warnings for the use of cefuroxime during pregnancy. FDA Pregnancy Category B. No proven risk in humans. That's all the information about cefuroxime we collected. Thanks for listening. Do not forget to like, share, and subscribe for the HeInfo channel if you like this video to update more health information.